different cameras.
Okay.
And I will check the pictures over with my doctor once we're done. Okay. I can't really say anything.
I understand.
But you absolutely will get results today.
Okay.
How long have you noticed this for? Did you just find it today?
It's been like 3 weeks.
Okay. Has it changed in size at all since you first found it?
I'm breastfeeding, so it varies based on whether or not I have milk.
Okay.
Like what I can feel.
Okay. How big does it feel to you today? Is it like marble size, pea size?
Well,
right?
it normally is like marble, but right now it's like pea.
Okay. Very good. And then right back onto that cushion. Yep. Put that left arm up above your head if you would. And I just need you to put a finger on it. Just so we can turn it up to me. I'm just going to look up under your arm before I move to that other camera, okay? We just check for lymph nodes up under here. Doing okay?
Yes.
Okay. Here. I like to warn you that it's a possibility she may recommend having a mammogram now. I know you're breastfeeding. It doesn't affect your milk or anything. Your breast will just likely be very dense. So we'll see if she even wants one at all, okay? She may or may not. Yeah, just go out to the right down the hall and have a seat, okay?
Thank you.
You're welcome.
She wants to do a mammogram.
Yes, to go along with the ultrasound. It's pretty much our protocol here for anyone over the age of 30 is to do a mammogram anytime there's a lump involved. Okay? I'm going to pass your chart along to the girls in mammogram, and they'll be out for you any minute. It's the same waiting area. Is that okay with you? Yeah? Are you just nervous about it?
Yeah.
Yeah? Okay.
I just didn't expect that. I thought you were going to say like, oh, you know.
Yeah, I know. But like I said, it's protocol here. I do know that you're breastfeeding. Of course, do you have a pump with you or anything?
I do have it, and I'm full.
Okay, so I would recommend that you do that beforehand.
Okay.
And I'll just put a little note on here that you're doing that.
Is there a space?
You can use any one of these dressing rooms, and I'll show you the one that would probably be best.
Okay.
The biggest.
Oh, yeah. That wasn't exactly what I expected to hear. I'm not gonna lie, my heart dropped a little. Like, what? Mammo? I'm probably gonna call Sharif. I just wanted to let y'all know that I went into this really confidently, and
This is where they've given me the pump. You know what I'm saying?
Of course.
Like when you're thinking about this whole setup, you're just like,
yeah. It's a lot to take in.
In a short period of time.
Yes.
That I was having this.
The mammogram. Yeah.
And then when I discovered that I wasn't,
Yeah.
I was like, oh, okay, great. And then they said this. And I'm like,
Well, there's a couple different factors. Like, I don't want you to...
Right, oh, yeah,
There's a couple different factors. Being the fact that you're breastfeeding, that makes a difference. Because when you're full of milk, it makes it harder for them to see through things.
and that's why I brought my pump.
Yeah,
And
yeah.
But everything, I expected a little time, so I apologize for that.
Oh, my gosh, don't worry about it. Don't apologize.
Okay.
'Cause we want you to do that right before anyways.
Okay.
Because then we know that you're not starting to really fill up that much.
Right, okay.
So you're as empty as we can get you.
Okay.
So they may go back into having just to scan that area where they have a baby now that they have you empty.
Right, okay.
But you're 37, not out of the ordinary for a protocol to have you come and get a mammogram anyways. So
Okay.
they probably automatically did the breast ultrasound without even going to the doctor first. And that's probably when she said, well, can we do a mammogram
Right,
too?
okay.
So I don't want you to freak out
Okay.
saying it's because they saw anything or anything. Because I was looking at the flash and it looks like when they called for the script, they only wanted you to have the breast ultrasound at your doctor's office. So
Right.
that's probably why they only just proceeded with that and not even starting with the mammo.
Okay.
Because usually any sort of lump, we will always do a mammo, we will always do an ultrasound. So
Okay.
I don't want you to freak out thinking that doctor saw anything.
Okay.
That's just how our protocol is. It just went a little flip-flop.
Okay. Oh, I get it. Okay.
I don't want you to.
Thank you for taking the
bit.
time to really explain that thoroughly to me, because that was a little like.
Well, yeah, especially when you're like, oh my gosh, I just had the test I thought I was having done. They want more.
Right.
Yeah.
Right.
Yeah.
Thank you.
I'm thinking it probably has to do with the vacuum.
It is an ultrasound in the area where you're feeling something. We are seeing a solid nodule. Solid nodules can be benign. When someone is breastfeeding, the breast tissue responds more to the hormones, and sometimes things like adenomas or fibroadenomas can become larger, and they might have been there, but they increase in size and become palpable. But we cannot exclude the possibility of something else without taking a tissue sample. So I can tell you there is a solid nodule. It's indeterminate. It is something that you're feeling. The two options would be to biopsy it. If we do a biopsy, because you are breastfeeding, you would be at the risk of potentially forming milk fistula, which means that it's possible to form a tract between the skin through which the milk would be draining, and in that case that could require surgery for therapy. Or we could continue to keep an eye on this by imaging and kind of keep a close eye and see whether this changes or not. I don't know if you have what your take on that would be, if in terms of, would you prefer to have a definitive diagnosis and know what it is, or would you like to keep an eye on things?
Oh my God.
I know it's a lot.
Just let me process for 1 second, okay?
Absolutely, take your time.
Okay, I'm gonna ask a series of questions.
Absolutely, please do.
So it looks like something is what I'm hearing.
Well, we do see a solid nodule.
A solid nodule
yes.
could be cancer.
I cannot exclude the possibility of cancer without putting a needle into it. There are benign things that can look like that.
But if I get the biopsy, which is the needle in there,
We will tell you with certainty what that is.
it will tell me with certainty what
Yes.
it is, but it will also...
It would put you at risk for potentially forming milk fistula.
And then I would need surgery.
If a milk fistula does develop,
What is a milk fistula?
fistula. So fistula means a tract, which means an opening. So right now you're breastfeeding, so there is milk that flows through your ducts. When we do the biopsy, we put a needle in, so it goes through the tissues. So while in the majority of the cases, the tissue will just heal, very rarely, because people's bodies are different, sometimes the healing will not close the tissue completely, and so the milk can start draining through the areas that the needle went through. If that were to develop, the way to treat that would be surgery. We do have to mention that because there is a small risk of that developing.
What would you do?
It's really hard for me to say because I'm not in that situation.
But if you were?
I personally tend to like to have definitive answers, but everyone is different. I cannot make that decision for you. So if you wanted to talk to your doctor, if you wanted to talk to your family.
A nodule.
You have a solid nodule, yes.
It
in
is.
the areas that you are feeling something. And it's indeterminate with the ways that it looks. There are benign reasons for someone to have a nodule like that. So it could be benign, but I can't entirely exclude the possibility of cancer without taking a tissue sample. So with the ways that it looks, it's indeterminate. I cannot tell you with certainty that it's benign. So the two options would be to watch it, keep a close eye on it. If it grows, we would biopsy it at that point. or we could do a biopsy in the near future. And
So keeping it close, what would that look like?
We would continue to do ultrasounds in short intervals. It's something that you can feel, so we would also ask for you yourself to keep a close eye on the area. So if you feel like it feels larger to you, we would ask you to come in sooner.
Okay.
Okay. And I know it's a lot. If you do want to talk to your doctor to kind of help you.
I don't need to talk to a doctor.
You can also change your mind. So if you decide.
Have you seen this? Does this occur in breastfeeding women?
Yes, it does.
Commonly?
Not commonly. I have seen similar changes, and again, I have seen them for benign reasons, which are more common than cancer. But sometimes cancer can occur, so I cannot tell you with certainty that it's benign. If it looked with certainty benign, I would say we're done. Unfortunately, I cannot tell you that. It has imaging features that are somewhat more reassuring. It's oval, it's parallel, it's
I'm sorry.
circumscribed, but it's solid.
Okay, 1 second.
Yes.
Okay. You're saying it has imaging that is oval. What is that? Can you say that again?
Yeah, there are certain things when we look at the way something looks at that makes us lean more towards things are probably benign, and there are things that make us be more worried about things. So what we're seeing makes us think more that this is probably benign, but I cannot exclude the possibility.
I understand that, but what are those things that make it look like it may be benign?
It's oval, so it kind of looks oval. It's parallel, which means it's longer rather than tall when we look in relation to the chest wall.
Is that typically what it looks like when it's benign, or no?
So more commonly it's seen with benign findings, but sometimes cancer.
Oh my God, this is really like, okay.
It's one of those things where I cannot tell you. I kind of from your questions, I'm getting a feeling that you want me to tell you that.
No, I'm not. I don't want to. I like reality. I want to deal in facts.
So I can tell you, if we biopsy this, I would not be surprised by either outcome. Benign things are more common. So benign things are more common than cancer. So.
But it's solid. This is solid.
This is definitely solid. Yes, this is definitely a solid nodule.
And solid is cancerous.
No, solid means that it's made of soft tissue. So solid means that it's made of solid tissue, basically. And there are benign things that can be solid, such as a fibroadenoma or an adenoma. But cancers are solid as well. So the fact that it's solid, it just means that it's a solid nodule. It doesn't make us lean one way or another.
Okay, so how often would I have to come back?
I think initially I would want to keep a closer eye on this because you are breastfeeding, and so I would probably have you come back within a couple of months earlier if you feel like it's growing. If you change your mind and you decide that you want a biopsy, you could come back at any time.
And if this was cancer, it could grow rapidly.
There are different types of cancers. Some of them grow rapidly. Some of them can change very little over months. So there are different types of cancer.
Okay. I think I'm going to keep an eye on it.
Okay.
I really don't want to open the door to possibly having to need this surgery if the milk.
If a milk fistula develops.
Right.
I understand. It's a rare complication, but we have to discuss the possibility of it. So I'll send a report to your doctor saying that this is what we're seeing. We've discussed the option of a biopsy versus close monitoring by imaging. For right now, you'd prefer to keep a close eye on this.
Okay. I think I need to talk to my. I think
and I understand that.
Yeah, this is a lot. Okay. All right.